Well, experts believe the vaccine manufacturing capacity can go a long way to pandemic-proofing Africa. Now, this is a key theme of the Africa Health Conference, which begins on Monday, and it will also discuss safety, efficacy and uptake of COVID-19 vaccines on the continent. Epidemiologist Professor Charles Shey Wiysonge is one of the participants, and he speaks to us now. Good morning, Charles, and thank you so much for joining us. Now, of course, please tell us more about Africa's role in this conference and what exactly will be discussed to make sure that Africa will be also now the center focus when it comes to the manufacturing of vaccines, but also getting our people vaccinated.
Thank you so much for having me. In this conference, there are going to be various components, and the part where I will be speaking will be focused on vaccines. And this would be on issues right from the development, research and development of vaccines through the uptake, and also factors that are associated with psychological factors that may be associated with uptake of vaccines, like vaccine hesitancy and all of that. So it's actually going to be a wide range, and people are going to be at this conference with various expertise, both from research and development of vaccines, clinical trials, and also social scientists.
Now let's talk about hesitancy, especially on the African continent. Are we one of the biggest continents or countries, we can talk country specific as well, that's hesitant towards taking the vaccine?
Yeah, hesitancy is of course an issue, and as you would know, factors that are related to uptake of vaccines will range from supply, availability and access up to hesitancy. In various parts of Africa, access is still a big issue. People do not yet have a lot of access to the vaccines, but even when they are available, there are also issues around misinformation and conspiracy theories, which have led some people to really doubt the safety and efficacy of these vaccines. So various studies have been done here in South Africa and in other African countries looking at people's willingness to take COVID-19 vaccines, and it really varies. And so you would have countries like Ethiopia, where the willingness is about 94%, and it has varied a bit from various surveys, to countries like the Democratic Republic of Congo, where only about 50% of people are willing to take the vaccine. So it varies. And also even in some countries, it varies from time to time, because depending on issues. If you take, for example, here in South Africa, when, for example, the Johnson & Johnson vaccine was paused because they were looking at certain safety issues, that, of course, reduced the willingness to take for some people. But eventually, as people get more information, it increases. So it is really varying, but we do need to provide the right information.
Now, I also read that, the aim is to get 60% of Africa vaccinated as soon as possible. But when we talk about as soon as possible, what does that time frame look like? And what's the possibility that we can get that done maybe even in the next 4 months?
It would probably be a high mountain to climb to get all of Africa vaccinated within the next 4 months, because there are still issues. In many parts of Africa, maybe we do not yet still have enough vaccine supplies. And vaccinating the whole population is not an easy task. We would want everybody to be vaccinated like yesterday, but of course, many things go into play. There are also other health services that need to be provided. We need enough manpower, health workers to be able to provide this. We need enough vaccines to provide it. We need enough health facilities where this could be provided. Or if we need to go out into the communities, we need teams to be able to do this. So this is quite a massive task. And as we have seen from South Africa, this can be done. Over the last few months, we have seen how access has become less of a problem in South Africa. We have opened up vaccines to many age groups, and many vaccine sites have been opened. There have been vaccination sites along grand queues where people are waiting to take vaccines. There have been mobile vaccination sites, maybe in places where you would not usually have vaccinations, like in Cape Town, we have like our convention center being a vaccination site, community centers being used for vaccination. So this can be done. but it requires a lot of effort.
So let's then talk about manufacturing. Is that the answer to maybe get more people vaccinated on the African continent? And because we are behind, we are lagging, Africa as a whole, when it comes to the manufacturing of vaccines. How can we solve that problem?
To solve that problem, maybe we need to first know what the issues have been, why we have not been able to solve that problem. And we can also see from what happened with the COVID-19 vaccines. How did we develop vaccines so rapidly? It was because there was a massive injection of cash, financial resources from governments, from various private sectors, and all of that. And also need a talent pool of people who are able to manufacture these vaccines. In Africa, we do have a shortage of the talents to manufacture, but that does not mean that we don't have. There have also been a lot of brain drain from Africa, but we do have very excellent scientists, and there are infrastructures like BioVac in South Africa, which can be able to manufacture vaccines. We do need a lot of investment, both from the private sector and from government, so that this does not only rest on the part of the private sector. So if we do all of this and have a good plan, I would like to have a very good plan and monitor it along the way. We will be able to manufacture vaccines in Africa. What has been said for other vaccines is about Africa manufactures only about 1% of its vaccines, and this is beyond COVID-19 vaccines, other vaccines. But we know that vaccines have been manufactured in Africa. They have been manufactured in South Africa. The yellow fever vaccine has been manufactured in Senegal, and so it can be done.